Welcome to our exercise oncology webinar series. This is week 2. In our refresh, we did this in the spring and now we're doing again in the fall. And today we want to look at professional development and career pathways in exercise oncology. If you are an undergraduate student in exercise science and you're thinking, I'd like to learn more about this field, I'm not really sure if it's for me or not, or if you are sure, if you do think that this is the path that you want to take, I'm hoping that this lecture today will kind of help give you some ideas on how to get started, what are some different competencies that we're looking for people to be working in this field, and then how do you progress through this field. So all of that being said, the different topics that I want to cover today are just this growing field of exercise oncology. We're seeing more momentum in this field than ever before. I have been working and conducting research in exercise oncology since 2003, and never before have I seen such interest, such acceptance by the medical community. We even have some payers that are interested in learning more about this. And so there is so much momentum right now, which means we're going to have more jobs that are open, more the workforce that we need to be able to deliver these services is only going to continue to grow. So that's really important. Then I want to talk about some of the core skills and knowledge for an exercise oncology professional. So what are some of the things that we're looking for whenever we hire someone, whenever we train someone to work in this field? Next, I'll discuss some career pathways in exercise oncology. And then finally, just some professional development. If you're looking to kind of tweak your skills or improve on a couple of things, we're going to cover those as well. So the impact of an exercise oncology program, we are meant to serve as a complement to the traditional therapies and treatments that are involved in cancer care. So we're a complement to chemotherapy, to radiation, to the surgery, to the targeted therapies that patients get. We are not intended to replace any of those therapies. But when a patient exercises while they're undergoing cancer treatment, we do expect that they're going to have better outcomes. The research does show that these patients do tend to have better outcomes, higher functional status, lower fatigue, higher quality of life, even improved survival rates compared to people who don't exercise during cancer treatment. So exercise truly is a matter of life and death. When you are prescribing exercise and working with someone that has cancer, you truly are going to give them the best chance to fight their cancer, to feel good while they're going through cancer treatment, and potentially even survive longer than what they would had they been sedentary. So when we talk about exercise oncology, if we're going to define this term of exercise oncology, essentially what it is it's the use of physical fitness to enhance the lives of people with cancer and cancer survivors. So we're using exercise essentially to improve quality of life. And I like to kind of talk through the history of exercise oncology because I think it's really important to see how we got to where we are today and what are the things that have already happened that give us confidence that this momentum is going to continue on into the future. And so I have kind of just the history of exercise oncology in the research, but I also have sprinkled in my own experiences and the work that Mapletree has done and the kind of the growth that we have seen, because very much that parallels the growth in the field. So as the field has grown, so has the footprint and the platform of Mapletree. And so if we're going to look all the way back to the beginning of exercise oncology, we're going to go to 1955. That was the very first study that was published in exercise oncology. So essentially, Dr. Stephen Rausch, who was of the WinStar Institute in Philadelphia, Pennsylvania, ran an experiment that he thought was going to show exercise increased mortality rates of people with cancer. And so essentially what he did was he had rats and he gave those rats cancer, and he had a group of rats swim and a group of rats stay sedentary. And he thought that the group of rats that swam were going to have higher mortality rates than the sedentary rats. And his thought was, well, the exercise is going to increase blood flow throughout the body, and that is going to cause the cancer cells to spread, and you're going to see an increase in more aggressive cancer, larger tumor size, and that's going to cause mortality of these animals. Well, actually, he found the exact opposite. So, what he found was the animals that were forced to swim actually had lower cancer deaths than the sedentary animals. So, not at all what he was expecting to see, but essentially, this study was the birth of exercise oncology. Now, what is surprising, I think, is that we didn't have another clinical trial out of this field until the mid 1980s. So we have almost a 30-year gap here between the very first study that was conducted and then the first human clinical trials that we see. So in the mid 80s, I believe it was 1986, was when we started seeing the first human clinical trials of cancer, and they were primarily in patients who were receiving chemotherapy. In 1994, that was when the Rocky Mountain Cancer Rehab Institute was established at the University of Northern Colorado. I had the opportunity to study here and get my PhD and to train under Dr. Carol Schneider, who was the founder of the Rocky Mountain Cancer Rehab Institute. And she founded this institute based on her own experience with cancer. So she was battling cancer, she was dealing with some of the side effects. Her doctor was not really able to offer her much relief for the side effects that she was experiencing. So, Dr. Schneider, being an exercise physiology professor, realized that a lot of the symptoms she was experiencing, such as, fatigue and muscle weakness, could be alleviated by exercise. And so she started exercising as part of her recovery and kind of documenting her journey. And that is what led to the establishment of the Rocky Mountain Cancer Rehab Institute. And even still to this day, this institute is still up and operational. They have a lot of research and a lot of publications have come out of this. And I really look to her as, one of the founders of this field, because even though we did have research before then, it was really her that I think systematized the exercise programs that we do and kind of added structure to what it is we wanted to accomplish in the life of a cancer survivor. So I had the opportunity to train and work under Carol Schneider from 2003 to 2006 when I graduated. And then I moved to Ohio with my family, and I'm working as a professor at Wright State University. And the following year, my grandfather was diagnosed with colon cancer. And he was living about 4 hours away from me at the time. And we knew he had an aggressive tumor. We knew it was a bad prognosis. And so my advice to him was ask your doctor where's the nearest cancer and exercise program, because, I had seen all the benefits. I'd studied under Dr. Schneider. I had worked with lots of patients and seen how it can help them. The only problem is that my grandfather's doctor had never heard of exercise for cancer patients. He told me cancer patients need to rest, and that when I pushed, he said I didn't know what I was talking about, and, refused to consider any of the research for my grandfather, for any of his patients to exercise. So it was that experience that led me to start my organization, Maple Tree Cancer Alliance. So I officially started Maple Tree in 2011. And for the first 5 years, we were very small. I was going out talking to doctors, trying to convince them, trying to show them the research that existed in the field of exercise oncology. And I would get some, a little bit, here and there, people would be interested about it and hearing more. And slowly they started referring patients to us, but it was very slow. Our first year, we served 17 patients the entire first year. So you can see that it was just a slow process in getting things up and going. I think the turning point for us was in 2016, which was when we opened our first clinical location, and that was inside of Kettering Health, which is here in Dayton, Ohio. And that kind of gave us a structure, kind of gave us a way that we can work within the hospital setting and become a part of the standard of care for those patients that are at that healthcare system. So continuing on in 2018, COSA, which is the Clinical Oncology Society in Australia, made exercise part of standard of care for their patients, which was a huge milestone. They were the first country in the world to do this. And it was very encouraging to me because I thought, okay, we're on to something. If Australia is making this standard of care, if they're saying that their patients need this, then hopefully soon America will follow. Hopefully soon the rest of the world will follow. We're still working on that, but we have had some milestones since then. So one that I wanted to point out here was in 2022, ASCO published guidelines saying that every patient that's being treated with curative intent should be referred to an exercise program. So that was a very strong statement by a US-based clinical oncology organization. Then in 2024, the NAPBC, which is the National Accreditation Program for Breast Centers, did make exercise part of standard of care for breast cancer patients. So again, another huge milestone. And then this year, in June of this year, the Challenge trial was published. You might have heard about this. It received a lot of attention, even on mainstream media, where essentially it was a study that was published by Dr. Carrie Cornier and colleagues. And it was colorectal cancer patients. They had nearly 1,000 patients that participated in this trial. And essentially, what they found was exercise resulted in a 28% improvement in disease free survival and a 37% decrease in overall mortality. It was equal to that of the medicine and the drugs that the patients go on to kind of prolong their life. So huge finding. It was a great study, received a lot of attention, as it should have. And we're hoping that that then kind of helps us in our conversations with CMS, which is the Center for Medicare and Medicaid. They're essentially the ones that determine, is this going to be a covered service so that all patients can get access to an exercise oncology program? We are working with them to make this a reality. We're also working with the Commission on Cancer to make exercise part of standard of care for all tumor types. So those are things that we are still actively working on. And I know that the leaders in this field, we have committed to not giving up until we've accomplished these two things. So I really do believe that we will be successful in getting these two things done. What has really helped kind of drive this is the amount of research that we have in exercise oncology. So it's more than just, oh, take a walk and you'll feel better. It's more than just even a patient telling their doctor that they felt better whenever they exercised. We have actual published data, now more than 3,000 published randomized control trials, which is the top tier of research that you can get, highlighting the benefits of exercise in cancer recovery. And because of this, that has helped the medical community really take notice that exercise is helpful and exercise is beneficial for their patients. In addition to the 3,000 published randomized control trials that we also have 30,000 peer-reviewed articles that are studies and reviews of literature, all of those things that go to support the role of exercise in cancer care. So it is undeniable. We do know that the documented benefits of exercise during cancer treatment can kind of be summarized here in these 8 categories. So essentially, we see decreases in fatigue, in sleep, in quality of life, anxiety, depression, body composition, physical function, and breast cancer related lymphedema. And this was out of a roundtable paper that was published by ACSM back in 2019. We do have a lot of endorsements for exercise oncology, both at the national level and in the international level. And you've heard me kind of touch on these as I've gone through this presentation and other presentations that I've given. But I think this is really important because this did not exist when MapleTree first began. These endorsements were not in place. So people, even 15 years ago, did not understand the benefits that exercise has in a cancer population. All of these have come within the last 7 to 5 years. And so you can see as more and more organizations and professional groups come on board in support of this, this field is only going to continue to grow and gain momentum. And so when I think about the workforce, what is it going to take whenever this becomes standard of care, whenever this is covered by insurance? I like to kind of show this graphic here because I think it's important and I think it kind of displays it really well. So we're saying there's about 1.8 million new cancer diagnoses every year in the US. Let's say 30% of these patients want to participate in an exercise oncology program. That's saying 2/3 of these patients are just going to be sedentary or they're going to do exercise on their own. We're only talking about 30% here. If we have 30% of patients participate in a 12-week long exercise program, we're looking at over 7 million exercise appointments every single year that these patients will undergo. This does not take into consideration if more than 30% of patients want to exercise, and it doesn't take into consideration the 20 million cancer survivors that are already living in the US that are going to be hearing about the challenge trial, that are going to see that this is standard of care. And they're going to want to start exercising as well. And so these numbers, I believe, are even modest whenever you think of the scope of cancer and how many people it actually does impact. Even with 7 million exercise appointments a year, we're still going to need about 50,000 trained exercise oncology professionals to be able to carry out these exercise appointments without a gap in care. Right now, we have just under 1,500 exercise oncology professionals. So you can see how we have a gap that exists. We are not quite to where we need to be yet in terms of making this standard of care, but we are on the way to get there, which is why I'm doing this webinar series, which is why I've started an exercise oncology program at my university, which is why we offer our certification, because we see that we need to train and build a workforce. So who constitutes this workforce? I believe that it is a three-tiered system. So at the very top, we have the specialists. We have the physical medicine doctor, we have the physical therapy, we have the occupational therapists. These are people who are impairment driven. So they're going to be working with specific patients that have specific impairments. And then when they're done, they're going to refer them to a certified exercise oncology instructor. This is someone who is trained and credentialed to work in the clinical setting with patients who are undergoing active cancer treatment. When active cancer treatment ends, I believe patients then should be referred into the community to work in community settings. So whether that's a YMCA or a JCC or any other fitness center, provided they have people on staff who are certified and trained in exercise oncology. So one of the ways they can do that is with the Cancer Fit certification, which is our partnership that we have with Livestrong. We have rewritten the Livestrong curriculum to Cancer Fit and now are going about certifying individuals. Cancer Fit is primarily for someone who does not have a 4-year degree in exercise science or in a related field, but works in the community, works in a fitness setting, and wants to work with cancer patients. They are not credentialed to work with a patient who is in active cancer treatment, but they can work with someone in survivorship and help them just to manage those long-term and late effects of treatment that patients experience. So if we're looking at what are the core skills and knowledge bases that make up an exercise oncology professional, I want to point you to this study here that was published in 2024. Mary Kennedy was a lead author on this. Essentially what they did was they identified, and this was through a Delphi survey process that they did, but they identified 103 core competencies across 10 domains that have been identified for exercise oncology professionals. So I'm going to go through those various domains and kind of talk about exactly what they mean and what we're looking for within each one. So first off is the physiology and biomechanics, making sure you have a strong foundation in the understanding of the components of fitness and how they relate to cancer treatments. Because this whole field began essentially because Dr. Schneider was experiencing side effects that were impacting her quality of life. And when someone exercises, we can target those specific side effects and help improve that for the patient. And so we have to understand what are these treatments, what are the side effects that result from these treatments, and then how can we use exercise to help attenuate those side effects. We also see a very high priority in exercise testing and assessment, competencies such as risk stratification, assessing baseline fitness testing. That's really important because I believe exercise prescriptions should be individualized for that person. So you need to know what they're starting with in order to prescribe safe and effective exercise programs. You also need to understand the ACSM guidelines for cancer survivors. What are contraindications to exercise testing? How do you safely progress someone who's in chemotherapy, who's in radiation, who's having a bad day? What do you do with those patients? It's important to understand those limitations and be able to address them with the exercise program. And of course, just those fluctuating cycles that happen throughout the treatment, you want to be able to adapt that exercise program accordingly. We also have some oncology specific knowledge. Now, understand we are not oncologists. We are not going to be treating anyone with their cancer. We're not going to be providing medical advice to someone with their cancer, but it still is really important to have a baseline understanding of cancer and its associated treatments. So, understand what surgery is, what chemotherapy is, what radiation is, how does that impact exercise tolerance? What are the side effects of treatment and how can you adjust for different things like neuropathy or bone metastases or a functional decline that often happens with cancer treatment? What are some safety considerations and emergency procedures? What if your patient has a fever? What do you do then? What are other treatment related emergencies and when do you know that it's time to call in for some help? It's important to make sure that you understand all of these so that you can stay within your own scope of practice. I always tell people we got to stay in our lanes, we got to do what we are trained to do, and let the other professionals do what they're trained to do. I think historically there has been some pushback with exercise professionals because I think on one hand, the medical community is not completely clear on what role an exercise professional plays in the clinical setting. And I think also historically, we have been known to sometimes overstep our boundaries. And so we need to know what is our lane, what are our boundaries, and how can we best support our patients. Psychosocial considerations are also very, very important. It's key to understand that, at Mapletree, 90% of our patients have never exercised before. And so we do talk a lot about behavioral strategies and how do you get someone to exercise when they've never done it before, when they're fatigued, when they have muscle weakness, when they're sick, when they're afraid. So we kind of teach how to speak into that. How do we conduct motivational interviewing? How do we do goal setting? How do we address some of these barriers? In terms of trauma-informed care, I think it's really important to understand the psychological trauma that goes along with a diagnosis so that we can provide compassionate, patient-centered support. People who have worked in the field of oncology for a really long time, I think sometimes we might just get to the point where it's like, oh, it's only stage 1. Oh, you'll be fine. But for them, it's the most traumatic thing that has happened to them. And they are so scared and so afraid. And so we want to understand those feelings that those patients have and provide that support that they need from us, understanding that we can improve their quality of life and really focusing on that patient-centered approach. So we really focus on providing empathy and patience and flexibility and understanding that you may have a patient that lashes out at you or that is angry and that may have nothing to do with you. It's probably all of these other things that they're experiencing. So with that in mind, how do you still serve someone and still let them know that they're seen, that they're heard, and that they're valued? And then finally, it's really important to understand where you fit in terms of the larger clinical setting that you're going to be working in. So, understanding how to communicate effectively with oncologists, with nurses, physical therapists, dietitian, all of those people so that you can provide the best integrative cancer care. I think it's important to have some level of medical literacy so that you can review and interpret medical records when needed. You can provide patient-reported outcomes to inform the exercise programming and communicate that back to the care team and use that to build trust with the clinicians. If they trust you, they'll refer their patients to you, but you really do have to build that trust with effective communication and understanding your role in the greater scheme of oncology care. So when we're looking at the various career pathways in exercise oncology, there are four main settings that I can kind of delineate from this very broad field. So we have the clinical settings. Again, I look at the clinical settings as more of working with patients who are in active cancer treatment. So from the time of diagnosis until treatment ends, that would take place in a clinical setting. That doesn't mean it has to be in person. You can do virtual exercise training, but that is what the clinical setting is relating to. And in the clinical setting, you're going to have conversations, you're going to have interactions with the other members of the clinical team. So understanding the roles of the physician, of the nurses, of the social workers. Back in the spring, we did a whole webinar on the various roles of the different people in the clinical settings and how we relate to them. So please feel free to go back. Those are all on YouTube. You can go back and listen to that one if you'd like more information. Community and nonprofit settings, I look at that as for patients who have completed active cancer treatment and want to continue on this healthy and active lifestyle. So in the community, we need people who are trained and certified to work with someone who's completed active cancer treatment. And we can do that in the community setting. In academic and research settings, honestly, this is a great way that we have found to get our foot in the door with a lot of academic institutions. And so oftentimes there will be a researcher there who is also a clinician who gets funding for a study, and we can come in and provide the exercise training for the patients as part of that study. So not only do you get to work with patients and make a difference in their lives, but you also get to contribute to this body of research that is truly helping to change the way cancer is cared for this country. So it's just a very unique opportunity and experience that you can have if you can get into an academic or research setting. And then finally, private practice, entrepreneurship. Never in my life did I think of myself as an entrepreneur, but when I started Mapletree, I guess that's what I was doing. And really, it was just this need to fill this gap that I saw that existed between what was happening in the research world and what was happening in direct patient care, and wanting to change that. And so there are now more than 2,100 exercise oncology programs in this country. And I think those numbers are growing every single year. And so, you can start your own organization and you can provide services that way. Because as I said earlier, the cancer problem is more than just a one person solution. We need all of us to work together to, for the good of these patients. So the professional development pathway, here's kind of what I have lined out or outlined as kind of the journey here. So I do believe that your best shot is to first get a degree in exercise science or a related field. We have some athletic trainers who work in this field, some with a public health background, but you want to get that 4-year degree because that will enable you to sit for certain levels of certification that you wouldn't otherwise be able to without that degree. Also, as we look to get credentialed so that down the road we can bill for insurance, you will need that degree as a baseline. So first, get your degree. Second, get some certifications in training. So of course, Mapletree provides the exercise oncology instructor certification. With ACSM, they have the cancer exercise trainer certification. There are other certifications out there. So find one that's going to be a good fit for you. And then you can explore graduate education, whether that's getting a master's degree in exercise physiology or going on to physical therapy school or occupational therapy school. Those are other pathways that are, very needed and that we do not have enough professionals in right now to begin with. And then, of course, the PhD route, if you want to work in academia, if you want to contribute to research. While you're doing that, I would advise you to take steps to continue your education and to become active and become involved in professional organizations, because that's really where the change happens. I can stand here all by myself in my living room and say, oh, exercise should be part of standard of care for cancer patients. And I believe that with my whole heart. But no one is going to listen to just me. If you get an entire professional organization behind you, like ACSM or like ASCO, then you're going to be able to have that platform and to have that voice that's really going to help inform change. So I would advise you, it is overwhelming. It is a little bit intimidating, I think, initially, but keep going, keep doing it. Go to these conferences, meet people, ask to speak, ask to serve on committees, and slowly make your way up to a point where you can provide, you know, guidance, and you can ask for people to kind of join you in this mission to accomplish this, to make this part of standard of care. In terms of the Maple Tree certifications, just because, if you are interested in getting, if you're interested in getting certified, here's the certifications that we provide. We actually have 3 levels of certification. We have the Exercise Oncology Educator, which is more of our site leader pathway. So our site leaders have this Exercise Oncology Educator certification that kind of teaches them how to run a site, how to collect data, how to communicate that data to the care team, and the different aspects involved with that. Then our exercise oncology instructor certification is one that we offer on a commercial basis. So anyone that has a 4-year degree or is completing their 4-year degree coursework is able to sit for one of these certifications. And again, this will credential you to work with a patient from the time of diagnosis through the trajectory of the rest of their life. Essentially, you can work with them during active treatment and beyond. And then finally, the Cancer Fit certification is for people who work in community-based settings. And this is going to be appropriate for someone who does not have a 4-year degree, but is going to work with a cancer survivor. I just threw this in here so you could see what the certifications look like. The EOI certification does come with 9 ACSM CECs and 0.9 CECs through NASM. We also have 0.9 CECs through NASM for the Cancer Fit certification, which again, we do in conjunction with Livestrong. And, I did want to just kind of end out with what are some of the challenges that we're facing here in exercise oncology. Again, the emotional aspect of working with a cancer patient, this can be hard because, we come into this very optimistic and understanding the literature and knowing that exercise can help someone with cancer. But sometimes cancer still is cancer, and sometimes we still lose our patients, and sometimes we walk with them through really, really hard things. And I know at Mapletree, a lot of our trainers are younger. A lot of them, this is their first job that they had out of college, and maybe they hadn't walked something so emotional before. Maybe they haven't gone through a loss before. And that can be very taxing and very hard when someone doesn't know how to deal with something like that. And so I think it's important to understand that reality when you're going into this field, that it's not always going to end well, and you are going to have some hard goodbyes, and kind of have a plan in place for how you're going to deal with that. Insurance reimbursement definitely is a limitation. It's something that I've been working on for the last 7 years to try to get insurance reimbursement. And essentially, when we get insurance reimbursement, what that means is that it will be paid for. Exercise will be paid for then. So right now, when we work with hospitals, the hospitals pay for the program for their cancer patients. But that means we're limited in the number of patients we can see. And, there's other organizations that are kind of in the same boat as we are that really do struggle because they don't have a lot of the funds or a lot of the means to be able to impact the lives of a lot of people. And so with insurance, that I believe will help us to be able to serve more people. And then navigating healthcare systems, it does take a long time to get through, the healthcare system. Make sure you're talking to the right person to, get a contract through legal. That takes a very long time. And so I think it's just having patience as you're navigating and working through those healthcare systems is going to be really important. Now, on the other side of those challenges are rewards. So you as an exercise oncology professional you're going to have a life-changing impact in the lives of these patients that you're serving. And that is going to extend to their families as well. I can't tell you how many times I've seen the children or the adult children of patients that we have served that have come back and said, oh, for Christmas, my parents wanted exercise equipment. They've never wanted exercise equipment before. This is amazing. They've seen the change in the lives of their loved ones, and that has changed the trajectory of their entire family. We do have a very high job satisfaction because the trainers who are working with these patients see the impact that they're having. They know that they're making a difference, and they understand that they're a part of something that is bigger than themselves. And I also think it's really exciting to be a part of this field where there is so much momentum, where things are evolving so quickly. You just feel like, again, this is something that's bigger than you, that you're contributing to, and you're really getting to make a true difference. So next steps, how I would recommend that you get involved. If I were you, I would recommend that you volunteer. So identify an exercise oncology program and ask if you can volunteer, ask if you can job shadow. I know for Mapletree, we have specific days every month where we allow people to come in and job shadow. We do have some volunteer opportunities, so don't be afraid to ask about that. I would also encourage you to join student and professional organizations and get involved, even if you're intimidated, even if you think, oh, no one's going to want to listen to me. I understand. I've had those same feelings as well. I think most people probably do. But what I've learned is if you push past that and you get to know these people, you understand that they're just as passionate as you are. They want to inform change just as much as you are. And when you put two people together, you're going to be twice as effective as one person standing alone. So don't be afraid to join things. Don't be afraid to ask to speak and do presentations, and to serve in committees and in positions where you really can have a positive impact. We also have an International Society of Exercise Oncology that we launched last year at the ACSM conference. We're going to have our first official meeting next year in Heidelberg, Germany. We are right now working on a journal to come out of this, and just different ways that we can kind of collaborate with people from across the world, because obviously cancer is a global problem, not just a problem here in America. And so we really want to bring together the leading researchers and the leading practitioners from all across the world so that we can work together to bring exercise oncology to cancer patients everywhere. And then finally, in terms of resume and career building tips, I think it's really important to highlight the relevant skills. So if you see a job posting, make sure that in your resume and in your cover letter, you're addressing those relevant skills and showing how you're a good fit. For any one position, there might be 20 applications, there might be 50 or 100 people who have applied. So you really want to try to find a way to stand out. And the best way that you can do that is by showing how you can hit all of those relevant skills that they're looking for. Don't be afraid to showcase your volunteer hours or your clinical experience, even in volunteer. That still shows that you took the initiative and you took the incentive to go out and to see if this field is right for you. The reason I knew physical therapy wasn't right for me was because I volunteered in physical therapy, and I realized, nope, I like exercise better. So if you volunteer and you have clinical experience and you still want to work in that field, that shows that you are on the right path. You're doing what you want to do. Of course, get certifications, do networking, try to contribute to research when and where you can. And again, don't be afraid to ask for help, to put yourself out there, to ask people to collaborate with you. And then finally, in terms of the future of exercise oncology, when I look to the next 5 to 10 years, here's really what I believe. I do believe we will have exercise be a part of the standard of care. I do think we're going to also see some advances in technology. So at Mapletree, we've just launched an app that all of our patients have access to. I think we're going to see more wearables, being used in tracking, activity levels and maybe other things as well. I know with my Oura Ring, I can track heart rate variability and body temperature and all those things. I think that data is going to be more accessible by the clinical community. So I think we are going to see advances there. And then emerging opportunities, I think eventually where I think this is going is we're going to have the opportunity to impact more than just cancer. 2/3 of cancer patients have at least one other chronic disease. And the road that we are paving for exercise oncology, I believe, will be shared by anyone with a chronic disease. I think 10 years down the road, every hospital is going to have a fitness center affiliated with it. And we are going to have the opportunity to help so many people who just need to add a little bit of activity into their life to really make a big difference in their quality of life. So stay tuned for that. I think there's exciting things coming. I'm going to email this out to everyone once this webinar ends, but here's just some key exercise papers that have come out that have established either guidelines or consensus papers, some podcasts I think you might find interesting, some books and resources, and different things that I'd like to make available to you. So again, I will email this out to everyone along with the recording for this webinar. So stay tuned for that. And if you would like to sign up for the Exercise Oncology Instructor Certification, we are offering a 20% discount right now. So if you use that EO Team code, you can scan here to register and you can get signed up for that.